Hello, people. My name is Jofri Kadia, and today I'm talking about pain. As humans, we have experienced pain in one way or the other through maybe a headache, or a stomach ache, or an accident, or a little injury, or maybe you were engaged in a fight, or someone slapped you, or there's a blow. All these things can lead to one form of pain or the other. So, pain can be seen as a sensory or an emotional experience associated with a tissue damage, either a real tissue damage or a potential damage that is about to happen. So, but it's a good definition. But in 1968, McCarthy was able to bring a more comprehensive definition that's being used today, which defines pain as a subjective experience where it's only the person feeling the pain that will know what the pain is and who can actually see where the pain is. So it's what the person says it is, and it is where the person says it is. So that is pain, and it's an unpleasant feeling. That's the best way to say it. So we have experienced pain. Sometimes when you have any injury, someone will be like, this small thing you're shouting like this, you can fear Nigerian slang. Or someone can be like, what I'm feeling, they should put it on your body, you just die. That is still a way of re-dramatizing or explaining that you alone can feel what you are feeling. Nobody can feel it. So somebody can have something similar, but it can never be the same as yours. So pain, there are many ways of classifying pain. First of all, we can see it in terms of duration. We have what we call acute pain, and from the name acute, it is sudden on onset. Like it just happens, and from when it happens to, let's say, 6 months. Yes, 6 months. Beyond 6 months is another thing, but from when it happens to 6 months, if that is the duration of pain, you can still rate it as acute. And acute pain sometimes resolves on its own, but sometimes also you need to act. If not, it can lead to chronic pain. So we have acute pain, then we have chronic pain. Chronic is beyond 6 months, it's chronic. So chronic might just begin, it's not very sudden, can begin gradually. You feel it's just something, then with time grows to become something bigger. And of course, you need to attend to chronic pain. You need to attend to it. You need to treat it. If not, you can have organ damage. Then pain can be classified whether it's physiologic or pathologic. So physiologic means it's normal, then pathologic is because of a disease or an external factor. So nociceptive pain is physiologic, while neuropathic pain is pathologic. Then the pain process. I know when someone slaps you, you can feel it instantly, but that does not mean that it doesn't follow a process. In the body, it follows a process. It might be in microseconds, milliseconds, nanoseconds, very little time, but there's still a process. So the process begins where either something mechanical or a chemical source of injury or pain. So the body now, through the receptors or the nerves on the skin or at whichever part, takes the signal, sends it to the central nervous system. Central nervous system interprets the signal as pain and sends back through the motor neurons to that organ and says, oh, there is pain, no, you need to run away, you need to withdraw, and before you know, you act and you respond. So the processes are four. I just summarize everything. We have transduction, then we have transmission of the signal, perception when it gets to the brain, there's perception, then finally there is modulation. So pain entirely affects different parts of the body. Every organ is affected in one way or the other. Let's take example the endocrine system, where hormones are involved. Almost every hormone is on an increase. When there's a hormone test during serious pain, hormones will increase. For example, cortisol, which is the stress hormone, will increase. Epinephrine will increase. Antidiuretic hormone will also increase, and many other hormones will increase. And when you look at the GIT, or the metabolic part of the body, the metabolism is affected because there is usually glucose intolerance, there is insulin resistance, and other things that affect metabolism. Then when you look at the cardiovascular system, the heart rate usually increases when there's pain, and like that, another effect. Then generally, when you have pain, there can be insomnia, which is lack of sleep. If the pain is very severe, it can stop you from sleeping. it can even make you very anxious, anxiety, be like, this pain, will it go? Hey, just be thinking, God, help me. Or you might also have restlessness, you just be worried, restless, you don't know what to do. Then sometimes it can even lead to you start thinking, this pain is too much, I cannot bear, let me just die. In cases of sickle cell disease or cancer, very severe pain can make someone to begin to think of dying. Then, so how do you know that someone is in pain? Since we say the subjective experience, so there are ways you can measure pain. There are scales that can be used. Some are used for adults, some are used for children. But the one that is mostly used is the numerical scale from 0 to 10, 0 being no pain, or sometimes they use 1 to 10, 1 being no pain, and 10 being severe pain. So you can ask a patient, or you can be asked between 1 to 10, 10 being the most pain or severe pain, and 1 being no pain, at where can you rate your pain? So from there, clinicians can be able to have an idea of how the pain is. And how do you assess someone, or how do you know, how do you manage or help the person who is in pain? First of all, you need to assess, you need to physically examine the person. Someone should come and the person says, I'm in pain. You need to look at the person physically, you hear what they have to say. Sometimes they can be holding the part that is paining them, or if you want to touch it, there's a withdrawal. You know that that's where the pain is. Then you need to take the vital signs and check the heart rate. Remember, we say organs are affected. So if the heart rate can increase, the breathing might increase also, and temperature might also increase. So you have to check this. It serves as a marker, as markers to help guide your diagnosis. Then since pain can lead to insomnia, it can lead to anxiety, it can lead to even thinking about death, you also need to reassure the person and tell him, don't worry, everything will be okay, you will be fine, we'll take care of you, and by God's grace, everything will be okay. Then if the person has pain on the right hand, you cannot lie that person on that right hand, because you will increase the pain. So you have to put him in such a way that the position will not aggravate the pain. Then if there's any prescribed medication the person can take, or you can administer to the person. And also you can use a hot compress or a cold compress. Sometimes people use ice when there's pain. People could use also hot water as compress to reduce the pain. So basically, this is what we have for pain. If there's any aspect you want us to elaborate, you can put it in the comment section. Don't forget to follow, don't forget to like, don't forget to stay in touch with us, because we are here to ensure that you understand whatever needs to be understood. My name is Geoffrey Kadia. Stay blessed.